Hi, everyone. Welcome back. I'm Dr. Samantha, the maternity mentor. I'm here for another one of our live Q&A Mondays here at 9 p.m. Eastern Standard Time. This is my chance to answer any of your questions live, as well as answer any of the questions that you've put into the chat. I really appreciate all of your support. Remember, you can find us over on Facebook and Instagram for additional content. And remember to like and subscribe to the channel. Subscribing to the channel really helps me out as a content creator. And your support has allowed me to be a part of the YouTube health platform. So remember, share the channel with your friends and family. And remember, put your questions into the chat. We had a lot of questions this week, so I'm going to go ahead and get started with some of those as we get warmed up for the evening. So we're going to start out with some questions actually on bleeding. We had a lot of bleeding questions this week. And so for starters, we had a question, we had a couple questions about color. So let's go with that. What about brown spotting? Extremely light brown spotting has occurred 3 times over 4 days, and I'm just short of 6 weeks. I'm really concerned because some sources say this is totally normal and happens a lot, but I'm not convinced. Are there any possibilities that aren't a miscarriage? I lost my first baby. My second is 5 years old now, and this is my 3rd pregnancy. I really don't want to lose this baby. Another question that I have related to color was, hello, I'm 6 weeks pregnant. This morning I noticed a little bit of thick black discharge on my finger. Please tell me, should I be scared? So I wanted to start out with these. I actually have a video that you guys can check out. We'll link those into the description on the color of bleeding. And actually, I should say it really is the color of discharge. So it's important to understand what you're looking at, what the quantity is, the description, because that helps us as healthcare providers figure out what's going on with you. So black and light brown are both signs of bleeding usually. Light brown is a sign of old blood. This is a bleeding episode that took place in the past. The past could be 6 hours before, 2 days before, a week before, and that's now resolved. Black is usually a transition between active bleeding and a bleed that has resolved. So bright red and dark red are usually the signs of bleeding, but bright red is an active bleed and dark red is this is starting to resolve. So when you see black, usually black is the color before brown. So these are important descriptions for us. Now, is there a reason why this could happen and everything still be normal? Yes, there is. There's a lot of reasons, especially in the first trimester, why you may have some bleeding. A lot of you guys who've been on here hear me talk about the hormones for pregnancy, the regular hormones for pregnancy, the healthy hormones. They thin out your vaginal tissue. And this is why it's so important that you do stuff during your first trimester, actually during the whole pregnancy, to make sure that when you're having sex, for example, that you don't tear, because these micro tears can cause bleeding that can be very distressing. So because you know that your vaginal tissue is going to be a little bit more frail, you want to make sure you're having honestly good sex. We have several videos on sex that we can link into the description, but it's important for you to be ready to go, for your body to be ready to go. When we talk about foreplay serves an actual physiologic purpose. So obviously foreplay is fun. But the reason why your body needs that as a woman is that what's happening is you're getting a whole bunch of blood flow to the vaginal area. That blood flow helps to basically like soften everything up and get some of your natural lubrication going so that when you are having sex, everything is looser. So if your vaginal tissue is very cold and it's very tight, you're going to have a lot of friction, and that can cause these tears. And so when everything is warmed up, then you can have better sex because the tissue is a little bit softer and has a little bit more give. Now, Some women are going to be able to have more natural lubrication than others, and there's many different reasons for that. For example, it is true that with pregnancy, you may not have as much lubrication. So we actually had a question this week, which I thought was a great question. And it said, is it sex is painful for me? What lubricants can cause diseases? So this is a great thing to bring in because, again, bleeding can be caused by basically rough sex or sex that causes micro tears. So lubrication. You basically have two kinds of lubrication out there. You have water-based lubrication and you have like oil-based lubrications. Now, the water-based lubrications are what you want to use. And the reason is basically pretty simple. It does, in theory, prevent disease. So lubrication on its own really doesn't cause disease, but we are worried about infection. Vaginal infections is another reason why you can have bleeding. So that's another reason. Now, is that normal? Of course not. We don't want any infections in the vagina. But is it treatable? Absolutely. So we have treatments out there to treat bacterial infections and viral infections and fungal infections and all that good stuff. So we do definitely want to treat those infections and prevent the bleeding. But we can avoid some of them depending on what's going on. So starting with sex, if you use any type of toys during your sexual play, you want to make sure they're clean. Cleaning your toys is extremely important. You also want to make sure the toys are made of a material that's easy to clean. If it's a material that can't be cleaned well, you probably don't want to use it, especially internally, because it might lead to infection. The oil-based lubricants and oftentimes can actually break down sex toys. They're actually not always recommended. The other thing is the oil-based lubricants can actually change the microbiome of the vagina. So the microbiome is the natural healthy bacteria that lives in your vagina to help prevent infection. So if you're using some of these lubricants, they can actually cause you to be at risk for certain types of infection like bacterial vaginosis. So using a water-based lubricant is very essential to making sure you prevent that type of thing. Now, if you guys are using a water-based lubricant already, if you're at high risk for infection or high risk for preterm birth or something like that during your pregnancy, make sure you guys have a fresh bottle of lubricant. You don't want to take you definitely don't want to take it for granted that a bottle that's being used for a little while might have gotten some bacteria in it or something like that. Just get a little small bottle, and when it runs out, get a new one. That way you can kind of prevent that. But those are actually a couple good reasons why you want to make sure that you're making sure that sex is honestly done right so that you can prevent that bleeding from there. So those are a couple reasons why you might have it. Now, a couple people, they wrote in, one of them said, my wife is 12 weeks pregnant. She has been bleeding for the last 2 weeks. We have done 2 to 3 scans and everything looks normal according to the doctors and the midwife. The baby's growth is also good. What could be the reason? The other thing is, another person said, I'm 1 month pregnant and I'm worried because I've had 3 days of bleeding. Is that normal? So to be clear, guys, bleeding is not considered normal. We do have some expected causes that can happen, especially first trimester. By the time we're getting into the second trimester, it becomes a little bit more concerning. But bleeding can happen and we don't know why. Now, we had another question come in that said, I'm 9 weeks and 5 days pregnant, and I've had heavy bleeding last night, though the baby is fine. The doctor said everything is fine and there's no subchorionic hemorrhage, but I'm so worried what could be the reason for the bleeding. And so there, ting, ting, ting is one of the causes of bleeding. So a subchorionic hemorrhage. So a subchorionic hemorrhage, you've got your uterus and you got your placenta. And the placenta is an organ that feeds your baby. And this side of the placenta is full of blood vessels. And this side of your uterine wall is full of blood vessels. And so you put it together and that creates that bed that feeds the baby, right? Now, that is going to be blood flow back and forth. Well, if you guys have ever like hit your skin and you've gotten that bruise underneath your skin, that bruise is broken blood vessels. That's all a subchorionic hemorrhage is. A couple of the blood vessels broke, and it's a pooling of blood underneath the placenta. Now, just like a bruise, a subchorionic hemorrhage can go away over time. It usually shrinks and the placenta gets bigger and it goes away slowly, kind of like a bruise, right? So, when you have that subchorionic hemorrhage, if it's close enough to the edge, sometimes a little bit of the blood will leak out. And that's the bleeding that you can see. But if your subchorionic hemorrhage was teeny, teeny, tiny to begin with, it actually may not show up on ultrasound. The other thing is ultrasound is not perfect, guys. It's one of the few imaging that we have left. It's getting better, but it's still not as advanced as some of the other stuff, and it could have just been missed. Second, you could have had a placental abruption. Now, if you Google placental abruption, you're going to get scary, scary stuff. A complete placental abruption is a medical emergency. Usually we do not see it until the third trimester. It is extremely rare. Placental abruptions are usually caused by somebody who's done drugs. Cocaine is a big offender. Somebody who's been in a car accident or some other kind of trauma. A placental abruption is where the placenta comes completely off. And remember, this is full of blood vessels that are open. This is open blood vessels. If this happens while you're pregnant, you and the baby are in life-threatening danger because you could both bleed to death. So this placental abruption, medical emergency. Every once in a while, somebody will have the teeniest, tiniest placental abruption. This is what I mean. You have your complete placenta and the tiniest little bit, teeny, tiny, tiny, will detach from the uterine wall. And that can cause bleeding. That is almost undetectable on an ultrasound. It happens super quick, it's super fast, and it's done. So it's there, you oftentimes won't catch it. Now, then there's also placental position. So uterus, cervix, okay? So your cervix is supposed to be long, thick, and closed, just like my fingers. And this represents where the mucus plug is. So your mucus plug, when you dilate, the mucus plug comes out, okay? So this is the cervical os. And what happens? Placenta. If your placenta comes down over the cervix like this is a complete placenta previa, complete. If you have this at the end of your pregnancy, you're having a C-section. Because if you dilate, you're going to bleed. You're going to bleed out, okay? This is a partial, and this is a marginal. So a marginal or low-lying placenta is not covering in any way, but it's sitting right there. And sometimes if just the tiniest edge is there, you'll get a little tiny bleed. Now, a partial previa, you have to have a C-section. But if you have a low-lying, oftentimes it'll migrate up, and then it'll resolve, and then you can have a standard delivery. So these are all reasons why you could bleed. Now, I'm going to put that on pause because I see 2 questions in the chat. So Andrew, welcome, welcome. What is the first sign of pregnancy? Okay, so that is variable depending on the person. However, I have several IVF moms who I am taking care of, and they seem to have this, and IVF, so you guys know, in vitro fertilization, these are people experiencing infertility. So oftentimes they know the exact day they got pregnant because they've either had an embryo transfer, that's where an egg was fertilized outside the body and implanted. They've had an IUI, which is an intrauterine insemination. This is where they take medication to release eggs, and then they have semen inserted into the uterus so they know when that's happening, or they have timed intercourse. This is where, again, they have medication that they take to release eggs, and then the doctor tells them exactly when to have sex in order to produce the best chances of having a baby. So these guys, honestly, are the best tell if you can find like a commonality to them. They're oftentimes the ones that I feel like have the best data for me. So 2 signs that I see early on: fatigue and breast tenderness. So breast tenderness is a little bit more obvious. When you're talking about fatigue, anybody can get tired for any reason whatsoever. Now, I think we have a video on signs of pregnancy. Actually, I'm not sure if we do. Other signs can be, the traditional nausea. You can get food cravings. I'll tell you personally, when I got pregnant with my first child, my daughter, up until that point, I used to eat an onion bagel every single day. And I was eating them. That was like what I liked. It was easy to grab for breakfast. And all of a sudden, one day, I couldn't eat the bagel. I felt fine. Nothing. I don't know. I didn't feel like eating the bagel. And then it happened again. And my husband was like, maybe you should take a pregnancy test. I'm like, no. And then I took it, and sure enough, I was pregnant. And it was just like all of a sudden, this one thing just didn't appeal to me. So it can be all sorts of weird stuff. But usually fatigue and breast tenderness, I think, is the most common couple signs that you'll see. Movie mode. Good night. I'm just joining. Can coconut oil be used as lube? Oh my God, great question. And I thought about answering this. It was like in my brain. So good question. Okay. So you guys know coconut oil is actually, honestly, a fantastic lubrication when you're not pregnant. Okay. Coconut oil is actually also really good to use as a nipple cream if you're breastfeeding postpartum. So coconut oil is very organic and natural. It has a lot of great properties to it, including like anti-infective properties. Now you do have to be careful. It has sugar. It's got natural sugar. So you could cause a yeast infection. If you're more prone to yeast infections, you probably do not want to use coconut oil because it could affect the microbiome. But a lot of people really do have a lot of good effects from coconut oil. But as I said before, it is an oil-based lubricant, and oil-based lubricants in a pregnant woman can affect the microbiome and increase your risk of infection. So during pregnancy, I would not recommend it. A final note on coconut oil, guys. Again, it is a fantastic nipple cream to use when you're breastfeeding. It can be used as a lubricant. You need to make sure you get organic coconut oil in a glass jar. So there's a lot of coconut oil out there right now that's not organic, that actually is mixed in with other cheaper oils. So you can actually find with some of the cheaper stuff that you're not getting a pure coconut oil. The second thing is the coconut oil absorbs the chemicals from the plastic very easily. So you can get a lot of those chemicals that leach into the plastic when the plastic gets warm, and then you're kind of putting that into your body. So I usually recommend that you get glass jars, especially if you're going to use it as a nipple cream when you're breastfeeding. So that was a great question. Any of you guys who are joining me, please feel free to put some of your questions into the chat if you have them. So I had, continuing with bleeding, I had a question. I'm from Bangladesh. I'm 9 weeks pregnant and there's bleeding. My doctor said the baby's okay. The doctor prescribed microgest pessary, Digest, Barbit, and Folita. Is this medication good for me and the baby? Please help. So, couple things with this. The first thing is I have to just say right off the top, based on how these are written, none of these are used in the United States. So I cannot say 100% for sure that these are safe. I am going to tell you a little bit about what I can see from it. If Folita is folic acid is absolutely very healthy for all moms during pregnancy. Folic acid is one of the most essential things that you can use as a pregnant woman for the health of your baby. Folic acid helps to prevent neural tube defects in the baby, which are defects of the brain and the spine, which can actually lead to miscarriage. So you want to make sure that you are taking folic acid during your pregnancy. Now, the other one, there was like basically what sounded like the root of progesterone. And the root of progesterone, or I'm sorry, progest, I think, is the root of progesterone. So now, progesterone is actually something that's kind of been we're kind of trying to figure out what we're going to do with it. For a while, we were giving women progesterone to help prevent preterm birth. Now it seems like some of that data is not actually panning out. It's not harmful to pregnancy, but they're not sure that it's helpful. Progesterone, however, is generally speaking relatively safe. It's not been causing any birth defects or anything like that. We just don't know if it's really going to be effective. The data seems to be that it's not necessarily changing outcomes. But if your doctor has prescribed progesterone, have a risk versus benefit, conversation with them, but it's probably, fine. So, that being said, if any of you have a question on the safety of a medication, right? So I think it's so great when you guys ask me questions. It's important to get second opinions. It's important to know your risk versus benefit. It is not good to delay care that needs to be given. So where else can you go to get a second opinion? You can go to your local pharmacist. Your pharmacist has access to a whole bunch of different databases. They can talk to you about safety and efficacy and risks and all that other stuff in case you're not sure. They can also look at other medications that you're taking and see if there's any interactions. If a woman misses their period, does this mean they're pregnant? No, it does not. In fact, women miss their periods for all sorts of reasons. So, for starters, you could be pregnant and miss your period and then have a miscarriage without ever testing positive. That does happen. Women can miss their periods because they get stressed out. Stress affects our cortisol levels and other like stress hormones, which can then affect our hormones and cause us to miss our period. If you're not eating well, women who don't eat enough can actually miss their periods because when your body is in starvation mode, it will actually stop you from menstruating. The other thing is, oh my gosh, I lost it. Oh, you can have different things like PCOS, which can cause you to miss a period. And then maybe that person has started something like birth control, and that's what's causing you to miss a period. But you can miss a period without being pregnant. So the only way to know if you're pregnant is to actually take the test. But if the test is negative, you also may be testing too early. So if you've missed a period and it's really possible you're pregnant, sometimes the first test is not good enough. Sometimes you have to wait a couple days and test again. That's very common as well. And then actually, I think related to that, since you asked that question, I mentioned PCOS. I did have a question on my PCOS video, and it said, I'm 21 years old and I'm a college student and I'm unmarried. My periods are irregular. When I do have my period, the bleeding is very light. Additionally, I have unwanted hair on my face and neck and I'm a bit chubby. Please, I want to prepare for pregnancy. What should I do? Please advise. So I have been finding more and more of my patients have PCOS. PCOS is polycystic ovarian syndrome, and I do have a video on it. Polycystic ovarian syndrome is basically where your body becomes insulin resistant and you have higher testosterone levels. And because of this, your hormones go out of whack and you have symptoms of higher testosterone level, like you have belly fat, you have hair all over your body, and this can lead to cysts on the ovary. And all of this together can actually cause you to become infertile. You can actually have a whole bunch of issues. I'm also going to tell you that polycystic ovarian syndrome is one of the things that I actually test for when I'm working up women who are coming to me for psychiatric help. So for those of you guys who didn't know, I'm a psychiatric nurse practitioner. So I've now moved into the mental health realm because I realized that we have so many families, both moms and dads, who need help. So with polycystic ovarian syndrome, you have 4 things that need to be tested at the same time. And this is actually key, guys. I'll tell you how many people come in and say, oh, I was tested. And then I find out only one of the things was done. So in order to truly rule this out, 4 things, same exact time: urine, HbA1c, fasting insulin. Oh, I'm such a liar. Testosterone, 5 things. and a CMP. No. Oh my gosh. CMP. Yes. Okay. Urinalysis, you're looking for sugar in the urine. Okay. If you're spilling sugar into your urine, which is in the form of ketones, that can actually be a sign of diabetes and insulin resistance. Insulin resistance goes along with PCOS. The only exception to that, guys, is if you're on the keto diet, which I'm going to mention in a second. All right. Fasting insulin. You want to know what your insulin is doing when you are not eating. If you are eating and if you're fasting and your insulin is super high, that means you're probably insulin resistant. CMP, complete metabolic panel, tests a whole bunch of stuff, some electrolytes, basic kidney, basic liver, but it also has a blood sugar in it. And that's what we're looking for. And that fasting blood sugar is key. If it is high, again, you're looking at possible insulin resistance. HbA1c is long-term sugar control. Now, all of this stuff is associated with diabetes, but diabetes is, I think, very interrelated to PCOS. If the HbA1c is high, that is another indication you could be in the right direction. Now, the last one is testosterone. Your testosterone is a key part of this. If your testosterone is high, that is a high indication that PCOS may be present. Now, they can do some follow-ups by checking your ovaries. They can actually do ultrasounds and stuff to see if you have cysts on your ovaries. But with those symptoms and those labs abnormal, even if there's no cysts on the ovaries, you can probably be assured that you have PCOS. One other thing I'll tell you, because I'm a lactation consultant and I had to learn this, if you're a woman and you have wide space between the breasts, you know how a lot of women, they wear a bra and they've got that just like standard cleavage line? Well, some women will have a wider space. If you have a wider space between your breasts, or if your breasts have more of a conical, almost like a triangle shape to them, that actually could be a sign of PCOS. Also, if you have very small breasts in comparison to a very obese body, a lot of women who become obese from PCOS, if you get fat, right, your breasts usually get fat with you. A PCOS mom who's not getting, like, PCOS moms, they like gain weight and it's not their fault. But if you have PCOS and you gain weight, but your breasts really don't, that is like a sign. Like if you didn't know you had PCOS, that's like a sign. Now, what is a treatment for PCOS? I mean, you can go. Metformin is a really common one. Metformin is used for diabetes, but also helps with insulin resistance. So that can be a great one. But honestly, guys, losing weight, you're going to hear about it. What's the best way to lose weight? Keto diet. And keto diet has actually been shown to reverse PCOS and reverse infertility problems related to PCOS. You can Google it. It's out there. I have a video on the keto diet because I'm very big on it. So please feel free to check that out. I don't think you need to go all not so crazy on it. You can do a version of dirty keto, which is just trying to eat ketogenic foods, but that can really help. Any of you guys are joining me, please feel free to put your questions into the chat. Hi, Jody. 32 weeks pregnant, and my right hand, I can feel 3 of my fingers, and my right foot is constantly swollen. Could it be I'm having a twin? No. I doubt that you are having a twin at this point in time. I think that sounds a lot like, okay, hand sounds like carpal tunnel syndrome. So carpal tunnel syndrome, especially if you're having feet swelling. So when you're having feet swelling, usually by that point in time, especially 32 weeks pregnant, a lot of times your whole body is getting swollen, right? So everything is swelling up. So one of the things with carpal tunnel syndrome, so this is your carpal tunnel space, right? So you have nerves coming down your arm to go into your hand to help innervate everything so that you can actually feel what you're doing. Those nerves have to travel through this space right here. Now, what happens is one of the people who get carpal tunnel syndrome a lot are people who work and they put their wrists down, right? And they put pressure on them, and that compresses this space, and the nerve actually gets pressed, right? And it causes tingling and pain and numbness in the hand. And you have different nerves for different parts of the hand. It's not all one nerve for all 5 fingers. It's actually different ones. So you could have partial in 2 or 3. That's very possible. When you're swelling during pregnancy, this space can actually just swell, and then you're getting all this pressure, which can cause the same thing. Carpal tunnel syndrome is extremely common during pregnancy. The unfortunate part of it is that we can't treat it. A lot of the times, the best treatment is surgery, and nobody's going to give you surgery while you're pregnant. They'll do some braces and suggest some other things. Now, your foot being swollen is a big deal. If you're swelling all over and your feet are swelling, you need to make sure you start to check your blood pressure. Swelling is one of the first signs of preeclampsia, and we have a video on that. But preeclampsia can creep up out of nowhere. We usually see it in the 3rd trimester, and it's a culmination of a couple of different symptoms, including swelling that leads to high blood pressure. That high blood pressure can lead to seizures. So you also want to be letting your healthcare provider know about your swelling and keep track of your swelling, because that's very important. Thank you regarding the coconut oil. I do get yeast infections, but find it helps me with sex during this time. I'll try to find out what. Yes, please do that, because it can change your microbiome. I did a urine test at my last antenatal checkup, and they found traces of sugar. My doctor mentioned that I might be hungry. Could this be a sign of gestational diabetes? I had PCOS. I have zero idea why sugar. Oh, okay. I know why they're saying hungry. Sorry, I put 2 and 2 together. Okay. They're saying the only way I could think that they were saying you're hungry could have caused sugar in the urine is if they were saying, oh, I see you had this question, movie mode. Okay, I was going to get to your question. Okay. Because I thought this sounded very familiar. Okay. So just so you guys know, every single time you go to your healthcare provider, they have you pee. I had one of my patients the other day. She's like, I don't really know why I go to the doctor all the time. It feels like I just go there and they do nothing. The most important reason to go to your doctor is the pee. That's the biggest reason why you should go. That pee is more important than you know. Every time you go, they put a little strip in that pee, and they're checking for 2 things. They're checking for sugar, and they're checking for protein. So sugar is an indication potentially of gestational diabetes. And gestational diabetes is a huge deal. And there's lots of risks if you end up with gestational diabetes. And we have a video on it. So you can check that out. But gestational diabetes can lead to several complications. And it's actually one of the most common causes of late stillbirths, okay? Babies that pass away very late in your pregnancy. And it's because the placenta stops working, and it can stop working very suddenly. So we want to find diabetes as soon as we can to help prevent it. So the reason why I think they said hungry is because, so with ketogenic diet, one of the things that's going to happen is the way it works is you don't eat a lot of carbs. Carbs are sugar. When you don't eat a lot of carbs, your body has to use some of its stores to produce that. And then what ends up happening is you spill ketones, like sugar products, into the urine. So the only thing I can think of is that maybe they thought you were fasting, and that because you were fasting, you had gone into a mini ketosis and some ketones were there. So that's why I think they said that, but it could absolutely be a sign of gestational diabetes. And that is something to take very seriously. Andrew, how do females know if their water has broken, or is there something else also after your water breaks? How long before it's time to deliver the baby? 2 good questions. So how does a woman know if her water breaks? Honestly, most of the time, we don't know. So I know you see in the movies and on TV where a woman's water will break and it's this big giant gush and there's like water everywhere. That is obviously your water has broken. But most of the time, women don't know. So in your last couple weeks, it's very common for women to show up in labor and delivery and say, I think my water broke. What we do to figure that out is we do a couple things. First thing is we have these little strips that can kind of test the pH of the wetness of your vagina to see if that's actually the same pH as amniotic fluid. But that's not really like super predictive. So the other thing we do is we put in a speculum. That's like a little instrument that it goes in your vagina and it opens it up so we can look at your cervix, and then we take a swab and we collect some of the secretions. Now, first of all, if your water's broken, sometimes we can actively see it kind of gushing out, but a lot of times we can't. So we take those secretions, we send it to a lab, and it tells us what is that. A lot of times it's pee. And that's very common at the end of pregnancy. Sometimes it's hard. You can have some incontinence, and we actually have a video on that. And so you can have some incontinence, and you can have some leaking of urine. And so when that happens, it can sometimes feel like you actually had your water break. But it's better to be safe than sorry, because how long does it take before it's time to deliver the baby? There's no way to know. Some babies come right away because you were 7 centimeters when your water broke, and some babies could stay in for months. So I have had women whose water has broken before the baby could even come out of their belly at like 20 weeks. And we've kept them pregnant until 26, 28 weeks. So like 2.5 months in the hospital. It just depends on the situation. The biggest risk when the water breaks is infection. At that point in time, that protective bubble for your baby is gone. Bacteria can travel up through the vagina, through the cervix, and into the uterus, and it can infect the uterine wall and potentially the baby, causing sepsis. And sepsis is life-threatening to your baby. It's life-threatening to you. So usually what happens is once we know your water is broken, we'll start to give you antibiotics. The antibiotics are buying you time. It's buying you time to prevent infection, to hopefully deliver the baby naturally. However, usually after about 36 hours, if you have not been able to deliver the baby, they will oftentimes recommend a C-section to prevent sepsis in the baby. So you're welcome, Jody. I hope that was helpful. I'm glad to hear that. So going along with some of this stuff, I had a couple questions on premature birth. Okay. And I actually had one on cerclages, which is kind of in the same realm. So the first one was a long one, and I thought that this was a good one for a couple of different reasons. So I had a nice long cervix with my son at 20 weeks. Then I was diagnosed with a severe urinary tract infection and given antibiotics. I was told the infection was cleared at my next visit, and subsequent urinalyses were normal. However, around 26 weeks, I began experiencing a lot of Braxton Hicks contractions, along with significant vaginal pressure. I called my OB immediately and was told it was probably normal Braxton Hicks contractions, since my cervix had been so thick at 20 weeks. They weren't concerned. I also began having yellowish discharge around 32 weeks with a foul smell that would come and go while I was still experiencing Braxton Hicks contractions and pressure. I called a few more times and discussed it with my OB at regular appointments, and again, they were not concerned. I ended up having contractions at 34 weeks and was given steroids, antibiotics, magnesium sulfate to stop labor. It worked to stop labor, but I was sent home dilated at 3 centimeters, and after 3 days on modified bed rest, my water broke at 35 weeks. I delivered my son. By the grace of God, he was extremely healthy and didn't need NICU care. I'm 42 years old, and my husband and I would like to have one more child, but I'm afraid of preterm labor next time. My doctor said they don't know why I had preterm labor, and that I would likely be at no additional risk of another preterm birth. I suspect it was due to untreated infection, but I will never know for sure. My son was born in June, and we would like to have our next baby as soon as it is safe. Would 6 months be too soon? I know there will always be a risk of repeat premature labor. Okay, since it happened once, but is there a time frame that carries less risk? So this was honestly a really great question, and it has a lot of different pieces that I thought were good. So for starters, we were just talking about like infection. And like, when I answered Andrew's question about like, what do we do? We're swabbing to also see if you have an infection. And the reason why it's so important, guys, when you're being prescribed a medication, you need to make sure you're taking it as prescribed. If there's antibiotics that are being prescribed for an infection, we're trying to prevent what happened to this person. And actually, I had a question on my antibiotic video. Is cefixime safe for use during the first stage of pregnancy? Yes, it is. Cefixime is one of many antibiotics we use. We use these antibiotics to prevent this. So let's start at the beginning of her stuff. We have our uterus, we have our cervix. Long cervix. This is what she was talking about. Long, thick, closed. Your fingers are actually almost the perfect demonstration for what your cervix looks and feels like inside. Okay, so that's at 20 weeks. So now, 26 weeks, she is starting to have stuff, and they tell her she probably doesn't have to worry because her cervix was long at 20 weeks. Guys, the only way to know the length of your cervix is to have another ultrasound. That's it. That's the only way. If you don't have another image, there's no way to guarantee that. People can have a long, thick cervix today, and tomorrow they can be 5 centimeters dilated. You cannot do this without an ultrasound. So I feel really bad for this person because that was very poor care. There should have been imaging. Okay, so we go on. Then I started to have yellowish discharge around 32 weeks with a foul smell. That is an infection. Infections are one of the leading causes of miscarriage, stillbirth, preterm birth. Absolutely. You should never have a foul smell coming from your vagina. That does not happen. You should also not have yellowish discharge. On my bleeding video, I believe, my bleeding colors video, I'm pretty sure I mentioned yellow discharge, definitely in my STD videos. And not all the STD videos are actually like sexually transmitted, like bacterial vaginosis is in there. That's really like a biome thing. But yellow, no, yellow is not normal. So that needed to be swabbed. And I'm saying this for anybody else. Hopefully this viewer's on, but for anybody else who's here, if you're hearing this with yourself, with a family member, you need to tell them they need to go to the hospital. That required treatment. Okay. So now we are at 34 weeks. We're given a whole bunch of stuff to stop labor. Why they didn't just treat, I'm not sure. 35 weeks, water breaks, and then the baby's delivered. Thank God that baby was able to come out and be healthy. I agree. Most likely the reason why the water broke at 35 weeks is the mom was probably going septic. At some point in time, the body's going to try to protect you and the baby by trying to deliver the baby early. So that's actually what I think was going on. Now, as far as like having another baby. Okay. You look at WHO guidelines and a lot of the guidelines from across the world. It is really essential for a mom's health that you wait 2 years from the time you deliver before trying to have a baby. Now, I need to tell you that those are the safe guidelines. It's called baby spacing. Your body needs a chance to recover from giving birth. And so if you don't give your body and your uterus a chance to recover, you're at higher risk for a whole host of complications. And so that's like really hard because you might, you're going to probably put yourself at increased risk when you try to have a baby earlier. However, you are 42 years old. So it's understandable that you may want to try sooner than later. It's really hard to say, but honestly, you shouldn't be trying too soon, in my opinion. Okay. Movie mode. I'm praying it's not gestational diabetes, but I do skip some meals and eat more fruits or light breakfast. I swear I'm always hungry. Lastly, how do I boost my water intake? And Jody's saying, what's the normal water we should be taking? Can I drink up to 4 liters different from juice? I mean, the normal water intake, guys, is about what it is like when you're not pregnant, 64 ounces, maybe up to 80 ounces. It's not like something drastic changes. But what I am going to tell you guys is pregnant women need electrolytes. I mean, everybody needs electrolytes, but pregnant women, y'all need electrolytes. Okay. I find so many women come to me and they're like, I stand up and my heart races and I feel a little dizzy for a second and all this other stuff. Y'all, that's dehydration and electrolytes. So you want to make sure you're doing that. Now, what you do is you drink sugar-free electrolytes. I usually just tell people sugar-free Gatorade because it's easy to find. It's like everybody knows what Gatorade is, but you need those other things. And actually, a lot of women will get Charlie horses, which is this really bad cramp in their calf. That's usually from lack of potassium. So when you drink stuff like Gatorade, you can actually prevent that. But you definitely want to try to do that. Now, if you're going to have a carb, going back to movie mode, like fruit, you need to pair it with a protein. So let me give you an example. I have a whole bunch of people who will come to me. Remember, I treat psych, right? And they'll be like, I wake up in the middle of the night and I'm super anxious. My heart is racing and I'm like, I feel like I'm having a panic attack. It's the middle of the night. Who wakes up in the middle of the night having a panic attack? That doesn't make sense. I mean, if you're having nightmares, maybe, but most people don't have nightmares. They're kind of rare. So what could be causing it? 9 times out of 10, when I talk to people, I'll say, like, do you drink alcohol before bed or do you eat a snack? And if they say yes to the snack, I'll say, hey, do you eat carbs? So carbs are sugar, right? So if you eat a cookie, that's carbs. Piece of fruit is also carbs. Rice is carbs. There's a whole bunch of things that are carbs, right? Well, what happens with carbs, and I think we all know this, like if you'll tell your kids, if you have sugar, you get this spike and then you get a crash. That's why a lot of people after lunch, they've eaten a lot of carbs, so they feel energetic for like an hour and then they're dead at their desk, like so tired, right? Now, going back to middle of the night, when my patients are eating carbs before bed, what usually is happening is their blood sugar is dropping. So when your blood sugar drops, you can get sweaty, your heart can race, you can get dizzy, you can actually feel a little anxious. And so what do I tell my patients to do? I tell them before you go to bed, eat protein. Eat an egg, eat some cheese, eat some nuts, eat some like anything like that. Sorry, I'm blanking. But protein is key to helping prevent that. And a lot of times what happens is that middle of the night thing goes away. Going back to you movie mode, make sure you're eating lots of protein. Protein lasts longer in your system and it's heavier. People who go on the keto diet to lose weight, by the way, y'all shouldn't be trying to lose weight if you're pregnant. When they go on that diet, a lot of times they'll eat less and they'll say, I'm full all the time. I feel so full because protein lasts longer. So you will be less hungry. And then Jody, don't drink juice. There's no reason to drink juice. Juice is not a healthy thing for us. None of us. And if you're a pregnant woman, I think there's foods to avoid. I think I have foods to avoid, not for gestational diabetes, but basically if you guys go to like the farmer's market or something like that, Whole Foods is another one where you can see those fresh squeezed juices, but they're like in a container. Guys, you are not allowed to have those if you're pregnant, okay? Those can actually grow bacteria and stuff, and it can actually make you sick. So you don't want to drink any of those. If it's literally squeezed literally in front of you, that's okay. But juice puts you at risk for gestational diabetes. So you don't want juice. What's the longest a female can stay pregnant? 40 weeks. Well, no, 42 weeks. 42 weeks is the longest a woman can stay pregnant. Pretty much at 42 weeks, we're going to try to induce her to have the baby because the placenta can start to fail. Is sugar-free Gatorade better than coconut water for electrolytes? Jess, that is a fantastic question. I should have mentioned coconut water. All right, so coconut water is actually a very powerful natural electrolyte. It's fantastic. And I'll tell you, I'm in South Florida, and a lot of the Caribbean women and South American and Central American women, they swear on coconut water as a means to prevent preterm birth. Now, what I think from being like in the biz is I think it's actually the fact that they're hydrating and they're getting good electrolytes from a natural source. I think that's what's actually preventing it. But let me tell you something. They all come in, if they're there in the hospital, the MFMs will tell them to drink coconut water. So like coconut water is fantastic. Only exception, if you have diabetes, if you have gestational diabetes, coconut water does have some carbs to it. So you need to make sure you're like modifying your diet accordingly, or you may just need to avoid it. But yes, coconut water is a fantastic electrolyte, and it's all natural. So that's always fantastic. So thanks for asking, Jess. That was a good question. Preterm birth. So we talked about preterm birth, right? So we had a patient who said, I had a cerclage placed at 13 weeks, but it failed at 20 weeks, and now I'm pregnant again. My doctor suggested a Schrodekar tape cerclage at 14 weeks, but I'm very scared about preterm birth. What is the success rate of this type of cerclage? So for those of you guys who don't know, preterm birth is usually your cervix starts to dilate and then you have a baby early. So a cerclage is a stitch that goes around to keep it closed. It's literally like sewing up a hole in your clothes. It's amazing. It comes with a needle, a surgical needle that's sterile, and a long bit of surgical thread. But that's all it is. And it's a suture. It's like sewing a hole. Keeps it closed. That prevents you from dilating and having a baby. When you're close to 38, 39 weeks, what we do, we go in, we snip the stitch, we pull it out, and then the cervix can dilate as normal. There are risks associated with it. For one, we could actually end up breaking your water. And these are usually done pretty early on, which means if we break your water, the baby is not going to survive. There is a risk of infection. There's also a risk that your body can actually fight the stitch and try to dilate without, like, no matter what we do. In that case, there can be damage and trauma to the cervix. So those are the three things with it. What are the chances? I wish I could tell you. There's no way to know. There's women who've had 7 cerclages with no problem. There's women who've never been able to get a successful cerclage. It's just no way to know. I wish there was a better answer, but there just isn't. My last question on preterm birth was, I'm 24 weeks pregnant and I have 1 finger dilation due to a severe UTI. My cervical length is 4 centimeters. Should I be on bed rest? Okay, so one cervical finger, what she's saying is fingertip. Okay, so fingertip means if this is the cervix, that you can put a fingertip in there. That's literally what fingertip means. Okay, cervical length 4 centimeters. That's what they're referring to. Okay, severe UTI. I think I've kind of talked to you guys all night about this. Infections can lead to preterm birth. This is why it's important to treat it. So, okay, you've been diagnosed with this. Should I be on bed rest? Nope, not unless your doctor told you to. So we have a video on bed rest. Bed rest is very important for certain people, but bed rest holds risks. When you're pregnant, for starters, you are immunocompromised. You're immunocompromised because if your immune system was working at full-fledged force, it would try to attack the baby because it would recognize some of the baby's foreign DNA as an invader, and it would try to go after the baby, which is why we do the RhoGAM shot, which I have a question on, and I'll answer that. But the RhoGAM shot is designed to help prevent your body from doing that if your baby is Rh positive and you're Rh negative, which are 2 different types of blood. So your body is also just going to do it on its own if you have a full-fledged immune system. So our immune systems are dampened during pregnancy. This is why women are at high risk for COVID-19, for the flu, for strep throat, for urinary tract infections, yeast infections. I could go on. And so as a result, if you are put on bed rest, you are actually potentially going to be at higher risk for pneumonia. So our lungs are designed to expand as we walk. And if we're just sitting around, our lungs are compressed and we're not taking deep breaths, and that puts us at risk. So that's risk number one. Risk number two is blood clots. So when you are pregnant, you are hypercoagulable. So that means that you make stuff in your blood that causes your blood to clot faster. Okay. There's a reason when you go to give birth, you're going to bleed. It doesn't matter how you give birth, you are going to bleed. And so when you're bleeding, your body needs to have extra clotting factors to stop that bleeding. But what do we do to prevent bleeding, clotting every single day? Well, we're walking around. And when we're walking around, our blood is pumping and we don't have blood sitting in our legs. Blood sitting in our legs can lead to a deep vein thrombosis, DVT. That's a big giant clot. And if that clot dislodges, it can be a medical emergency. And if you're put on bed rest, that's a huge risk. In the hospital, when we have women on bed rest, we actually have these things called SCDs. And there are these like compression devices that actually cycle on and off to mimic as if she's walking around to help prevent that. So you do not want to go on bed rest unless you're told to go on bed rest. And then you need to know what type of bed rest, because bed rest doesn't mean necessarily that you're doing nothing. You might be on a modified bed rest where you can do most of everything, but you're not allowed to stand for longer than 30 minutes or something like that. There's just so many different variations. Definitely check out the video, but what you need to do is clarify. But ultimately, guys, do not put yourself on a bed rest unless you've been told to. There's a lot of risks involved with it. Carbs are popular and always accessible. Yes, absolutely. With regards to juices, can cranberry juice from Ocean Spray brand be sweet and contribute to 100% cranberry? Ocean Spray cranberry juice is like delicious, guys. It is absolutely just garbage. It's basically just sugar. So there's a lot of misinformation out there. So you guys know cranberry juice does not treat a urinary tract infection. Let me repeat that. Cranberry juice does not treat a urinary tract infection. It can prevent urinary tract infections. So the reason why cranberry juice prevents is because it makes the urine more acidic. And the more acidic your urine is, the less likely bacteria can grow. And that's why cranberry juice is so helpful. And then D-mannose is another thing that a lot of people talk about. D-mannose does not treat, it prevents. It basically does not allow the bacteria to stick to the bladder walls so that it can't stay in there and overgrow. So that's why those two things can work to prevent urinary tract infections. The only thing that can treat a urinary tract infection is antibiotics. Now, going back to Ocean Spray, no, it's just sugar water. If you guys are going to drink cranberry juice in order to prevent, you need to drink the natural, yucky, nasty, in a glass bottle, really dark. There's sediment on the bottom of the bottle, so you always have to shake it, and it tastes horrible. Cranberry juice. That's actually the cranberry juice you should be drinking. It's real, it's honest, it's true, and that's what actually is the most helpful. But yes, Ocean Spray is delicious, but it's just sugar. That's all it is. Okay. I had a second trimester. Oh, let me do the RH question. So, do I have to take the RH injection after an abortion for future safety? And before I answer this question, because the abortion word is extremely controversial, abortion is used in the United States and in other countries to represent a miscarriage or an elective termination of a pregnancy. So I just want to be clear so that this is a judgment-free zone. We're not talking anything other than that term can legitimately be used for more than one thing. And so I just don't want any negative comments. So when you have a miscarriage or an abortion, an elective termination, you need to make sure you get the RhoGAM shot if you're Rh negative. So if you're O negative, A negative, B negative, AB negative, that means you have a negative blood type. If you can't determine the baby or the fetus's blood type, you need to assume the baby is positive and you need the RhoGAM shot. This is to help prevent your body from attacking another baby that is Rh positive. If you did not get it, a lot of times doctors will give it to you after the fact. Usually, if you are Rh negative, you're going to get it during your pregnancy as well. And then after you deliver, they're going to test your baby and they're going to determine what the baby's blood type is. And again, you will most likely get it if the baby is positive and you are negative. But yes, you want to do that. Second trimester, we had a question. I underwent a cervical polypectomy, 5.6 centimeter polyp, and 2 centimeters still inside my cervix, followed by a cerclage. Yesterday, I had a routine internal exam and ultrasound at 24 weeks. I experienced light bleeding and a few drops the next day. I'm worried if this is something serious or if it was caused by the internal examination. So second trimester bleeding is a big deal, guys. Once we're getting into the second trimester, we're getting close to the time when a baby could be born and survive outside of the belly. We usually are worried about different complications when we see this, but internal exams are the exception. So going back to the beginning of tonight when we were talking about sex and lubrication, the vaginal tissue is thin. And because it is thin, it can tear easily. So when you are having an internal exam, you can see some spotting the next day. You always report that to your provider, even though it's probably normal, because you want to make sure that they are aware of what's going on. But that is probably what happened, and there's nothing to really do. On my yeast infection video, has anyone experienced light bleeding that is bright red while suffering from a yeast infection during the second trimester? The answer would be yes, because yeast is highly disruptive to the microbiome. It makes the tissue, like if anybody's ever had a yeast infection, they'll tell you their vagina burns, and the skin of the vagina oftentimes will get very rugged, like the texture changes. It's rough on your vagina. So absolutely that can cause bleeding. And that is a big deal. You do not want any infections when you are pregnant. So yes, that could be a source of bleeding, which is why, when I was talking about the bleeding earlier, you definitely want to make sure that you're getting things checked out. 2 more questions and then we're done. So finish up with any questions you guys might have in the chat. I got a question on my blood pressure video. Is Concor safe during the first trimester of pregnancy? If anyone knows, please reply. My problem is a high heart rate. So Concor is also called bisoprolol. Bisoprolol. I hope I said that right. It's olols. The OLOLs are a category of medications called beta blockers. Beta blockers are blood pressure medications that also lower your heart rate. So we use them for a variety of different things. So it's the beta blockers are usually safe for pregnancy. We use them a lot. They're very important because we need to keep things under control. And a high heart rate during pregnancy can have a lot of catastrophic issues for both mom and baby. However, we usually recommend using labetalol. So I can't say for sure why bisoprolol is used in this particular situation. You need to talk to your healthcare provider and figure out why that was chosen. There could be a very good reason. You do not want to stop a blood pressure medication without strict guidance of your healthcare provider. There's a reason why you're on it. You need to make sure you continue it. But you can take this medication if that's what's recommended, but I would ask about labetalol. Last question of the night is on my depression video. Is amitriptyline okay to take during pregnancy? So amitriptyline is a tricyclic antidepressant. It's used to treat depression and anxiety. The tricyclics are some of the oldest depression medications out there. They have a lot of data on them, and they're really effective, and they can also help with sleep. Tricyclics are actually considered to be some of the safest medications that you can use during pregnancy. So usually we do. It's still a risk versus benefit, but there's no evidence that any of the tricyclics cause any risk for increased birth effects. So that wraps it up, guys. I am Dr. Samantha, the maternity mentor. I'm a psychiatric board certified psychiatric nurse practitioner. Guys, I'm tired. I'm losing my voice. Thank you so much for joining me here on Monday at 9 p.m. Eastern Standard Time. We are here every Monday to answer your questions live, as well as any questions you might have put onto the videos. Remember, share the channel with your friends and family. Follow us on Facebook and Instagram for additional content. Please like and subscribe. Subscribing is so important to keeping the channel alive on YouTube. So please subscribe. Please tell everybody you know to subscribe. This channel has so much information, I hope, for everybody. And part of the reason why I'm able to be a part of the YouTube health platform is because of you guys supporting the channel. I really appreciate everything. And I hope you guys do very well and join me next time. Hold on. How can one prepare their cervix if their vaginal area? Oh, movie mode. That's a different, save that question for next week. That's longer than I can explain right now. Short answer, pelvic floor therapy. I'm Dr. Samantha, the maternity mentor. Bye for now.